Imagine being the reason someone survives a health scare simply because you knew what to do. While you may not have years of medical training, there's a lot you can learn to handle emergencies, prevent illness, and recognize danger signals in time. By having the necessary knowledge about some important health tips, you can easily become half a doctor, a well-informed, life-saving individual. In this video, we'll explore 20 health tips that can save lives. It all starts with understanding the human body. Knowing a few basics can make a massive difference when minutes matter. For instance, learning CPR is more than just a good idea. It's an essential skill. CPR can literally restart someone's life while waiting for professionals to arrive. Many organizations such as the Red Cross offer online or in-person CPR training. You can save lives by committing just a few hours to learn this. Another life-saving tip is learning to recognize the signs of a heart attack or stroke. Heart attacks often start subtly with chest pain, shortness of breath, or nausea. A stroke might appear with slurred speech, arm weakness, or a drooping face. If you suspect either, call emergency services immediately. Speed is critical because treatments are most effective within the first few hours. Keeping a well-stocked first aid kit is an underrated but essential step towards saving lives. Don't just throw band-aids and antiseptic in there, think bigger. Include items like a tourniquet, which can stop life-threatening bleeding, and antihistamines for allergic reactions. These small tools can transform you into a prepared responder in emergencies. Hydration is another vital aspect of health people often overlook. Dehydration can lead to severe complications like kidney damage and heat stroke. Make it a habit to drink water consistently throughout the day, and remind others to do the same, especially during hot weather or physical activity. Speaking of activity, promoting regular exercise can prevent countless health problems. Something as simple as encouraging a friend or family member to walk 30 minutes a day can reduce their risk of heart disease, diabetes, and obesity. Exercise isn't just about looking good, it's about building resilience in your body.
This hydration. Is hydration just water in your cells? Actually, no, it's not. How does that water get into the cell?
Sudden discomfort. I don't use the word pain because some patients don't actually have a pain feeling, but they feel a pressure or a discomfort or a weight on their chest. Those are the kinds of feelings that sometimes can connect to a heart attack.
Nutrition plays a starring role in saving lives. Have you ever thought about how your daily food choices could prevent future illnesses? Teaching people the value of a balanced diet, rich in vegetables, lean protein, and whole grains, can drastically reduce their chances of developing chronic diseases like diabetes or hypertension. Handling bites and stings effectively can prevent severe reactions. For bee stings, remove the stinger gently and apply a cold compress to reduce swelling. For venomous bites, like snakes, keep the affected limb still and below heart level while seeking medical help immediately. Never suck out venom. It's dangerous and ineffective. Sleep is often called the body's reset button, yet we underestimate how powerful a good night's sleep can be for our health.
The results gave the team a pretty clear answer, one that came in waves. We've been finding out more over the past several years about the phases our brains go through while we sleep, and how those phases are essential to information processing and memory formation.
By simply encouraging others to aim for 7 to 8 hours of quality sleep, you're helping them reduce stress, strengthen their immune system, and even lower their risk of heart problems. Mental health is just as crucial as physical health. We often neglect it, but learning to spot signs of depression or anxiety in loved ones can make all the difference. If someone you know seems withdrawn, excessively worried, or uninterested in activities they used to enjoy, reach out. Just offering a listening ear can save lives. Preventive care can't be emphasized enough. Regular checkups, vaccinations, and screenings catch problems before they become serious. If you see someone procrastinating their doctor's visit, remind them that early detection is key to saving lives. Before we continue, make sure to subscribe and hit the bell icon for more updates. Let's move on with our video. Choking is a terrifying experience to witness, but knowing the Heimlich maneuver can turn you into an instant hero. Practicing it on a dummy or watching online tutorials can give you the confidence to step up when someone's airway is blocked. Never underestimate how this one skill can save lives. Recognizing allergies and their symptoms can prevent deadly situations. If someone around you mentions they have severe allergies, ask them if they carry an epinephrine autoinjector, like an EpiPen. Learn how to use it. It's simple but incredibly effective in halting anaphylaxis, a life-threatening allergic reaction. In today's digital age, learning how to perform basic wound care is another underrated life-saving skill. Cleaning and dressing wounds properly prevent infection and promotes healing. healing. Sterilized gloves, clean water, and antiseptic are your best friends here. It's straightforward but crucial in emergencies. Handling bites and stings effectively can prevent severe reactions.
Sudden discomfort. I don't use the word pain because some patients don't actually have a pain feeling, but they feel a pressure or a discomfort or a weight on their chest. Those are the kinds of feelings that sometimes can connect to a heart attack.
For bee stings, remove the stinger gently and apply a cold compress to reduce swelling. For venomous bites, like snakes, keep the affected limb still and below heart level while seeking medical help immediately. Never suck out venom. It's dangerous and ineffective. Substance abuse and overdose are growing issues, but having Narcan naloxone on hand can save lives. Many pharmacies sell it without a prescription. If you know someone at risk of opioid overdose, familiarize yourself with Narcan use. Administering it correctly could reverse an overdose in seconds. Burns are common, but often mishandled. If someone suffers a burn, knowing to cool it with running water for 10 minutes, not ice, is critical. Covering the area with a clean, non-stick dressing can also prevent infection while waiting for professional care. These small actions can prevent complications and even save lives. Chronic diseases often creep in silently. If you have family or friends with diabetes, encourage them to monitor their blood sugar regularly. Simple lifestyle changes, like reducing sugar intake or maintaining a consistent exercise routine, can prevent complications like neuropathy or kidney damage. Everyone should understand the importance of hygiene. Teaching proper hand washing techniques may seem trivial, but it's one of the easiest ways to prevent infections. Encourage washing hands for at least 20 seconds, especially before eating or after using the restroom. It's a small habit that can save lives. Recognizing the symptoms of dehydration in infants and the elderly can help you save lives. Babies and older adults are more vulnerable to dehydration, escalating into a life-threatening condition. For infants, watch for fewer wet diapers, sunken eyes, and a dry mouth. For older adults, signs include dizziness, confusion, or dark urine. Encourage regular fluid intake and, in severe cases, seek medical attention immediately. Be prepared for asthma attacks. If you know someone with asthma, learn how to assist them during an episode. Encourage them to sit upright, stay calm, and use their inhaler properly. If they don't improve within 5 to 15 minutes, call emergency services. Understanding asthma action plans and triggers like pollen, dust, or smoke can also help you support them better and potentially prevent attacks before they start.
We know that diets of cholesterol or fat-laden foods are increased risk. There's nothing new there. The whole emphasis of this wasn't to try to focus on the diet side. It's to try to prove that the gut flora is playing a role in the development of a metabolite in humans that's linked to heart.
Finally, learning to manage a fever might seem basic, but it's a critical skill, especially for parents. High fevers can lead to febrile seizures in children. Cooling measures like tepid sponge baths and proper hydration can help until professional help arrives. Every single one of these tips contributes to a world where anyone can step up during critical moments. With these tips, you're not just becoming half a doctor, you're becoming a hero in your community. Don't forget to staying calm in emergencies, as panic helps no one. Also, always be curious and willing to learn. The more you know, the better prepared you'll be to save